ECGs can look scary at first, just a bunch of waves and spikes. But the truth is, you don't have to memorize everything. If you follow a simple step-by-step method, you can read any ECG confidently. In this video, I'll show you the 5 essential steps you need to know as a beginner. First, let's understand what we're looking at. The ECG is simply recording the electrical activity of the heart. The P wave shows atrial depolarization. The QRS complex shows ventricular depolarization. The T wave shows ventricular repolarization. That's all you need to remember for now. Now, let's talk about counting heart rate. Heart rate can be faster, slower, or normal. Is the heart beating too fast, too slow, or normal? An easy trick: count the big squares between two R waves. 1 big square equals 300 beats per minute, 2 squares equals 153 squares equals 104 squares equals 75, 5 squares equals 60, so fewer squares equals faster heart rate. Here is a picture showing fast heartbeat and slow heartbeat. Now step 2. How to know about the rhythm. Regular, or irregular, or irregularly regular. Let's find out. Next, check if the rhythm is regular. Look at the R to R interval. If the spacing is consistent, the rhythm is regular. If not, it's irregular, like in atrial fibrillation. Now let's talk about axis. It tells you the overall direction of electrical activity. For beginners, just remember, if lead 1 and lead 2 are both positive right pointing arrow normal axis, that's enough for now, no need to complicate it. Now check the waves. Is there a P wave before every QRS? Right pointing arrow, that means atria and ventricles are working together. Is the QRS narrow or wide? Right pointing arrow narrow is normal, wide could mean conduction problem. Is the T wave upright? Right pointing arrow, that's usually normal, inverted T waves may suggest ischemia. Finally, look at the ST segment. If it's elevated or depressed, think about ischemia or infarction. Also glance at PR interval and quart interval, but don't stress too much as a beginner.
Here is a quick example to test your knowledge.
What is the number of heart rate of this ECG? Rate is 75 beats per minute. Don't worry if you did get it right. Now let's see if you can get the rhythm and axis right here. Look at it carefully. Rhythm, regular, and axis, normal. P wave, present before every QRS. QRS, narrow. T wave, upright, no major ST changes. So this is a normal sinus rhythm. Simple. And that's it. ECG reading in 5 steps. Rate, rhythm, axis, PQRST segment. If you practice this with a few ECGs, it'll become second nature.
Thanks for watching. See you soon.